like the solution-focused brief therapy or learning about Adler and Rogerian therapy, blah, blah, blah. But I loved the solution-focused brief therapy class. I think I liked it because it fits my personality of, okay, we're going to find a problem, we're going to implement steps to fix it, and go. And I really, really, I liked that about solution focus. So go ahead and hit the next one. Solution focused brief therapy, you identify the problem, but it's not, you don't go really in depth. So it's very useful in lots of different ways. EAP programs often use a solution focused brief therapy structure because typically EAP programs you get like, 4 sessions. And so you really have to be on task. It's not a process therapy. It's not existential. It's very brief. It's future focused. You don't dig into emotions. And it is collaborative. So it's not just the counselor saying, okay, this is your problem, you're going to do this. It's also, the patient figuring that out. It's them figuring out what is my problem and what are some good solutions for me to fix it. The counselor observes the client's responses to very specific questions. There is a specific structure that we'll talk about. Explores the history of the problem, but not the emotions or causes. So it might, when you talk about history and solution-focused brief therapy, it's very specific and limited. Usually things like, was there ever a time in your life when this wasn't a problem? What did that look like? I love it actually for some of my borderline patients, especially when they're getting all fired up and they're getting all emotional. I like to be able to say, stop, what do you need right now? Okay, let's do this. Because sometimes that helps focus them on action steps versus just being emotional and getting ramped up. So when it comes to solution focus, examine differences between what life was like prior to the problem and what life is like now. So that's where you might ask the patient, what was life like before this was a problem? So we might ask our patients, what was life like before you started using drugs? Tell me what your life was like. If I've got a patient that has been sober for a period of time, I ask them historically, okay, so what kept you sober for that 5 years? What was that like? I want them to also identify their own individual strengths as to why they were able to do well for a period of time. It supports the client by helping them identify their strengths, their skills, their internal and external supports. It really is, in terms of therapeutic models, I don't want to say it's the easiest one for counselors, but it's pretty easy in terms of it's all on the client. The counselor's goal is to help the patient identify their own resources, their own strengths, their own things that they can do. The other part that I really like about it is clients continually scale themselves. And this is something that a lot of different practitioners use. I use it all the time. So I might ask a patient, so on a scale of 1 to 10, where 10 is horribly overwhelming and 0 is not at all, how bad is your anxiety right now? That's helpful for me because sometimes I might look at a person and think, oh, they're not at all anxious. And they might scale themselves as like a 10. I'm like, okay, that's what that looks like then. It also helps in terms of when you have a patient that feels like they're not making progress. I always write down their scale, and then I can say to them, hey, wow, okay, so you say that you're an 8 today, but last week you were a 5. What happened to create that change? What has happened to move you up to an 8 or a 9? I also will ask things like, okay, so you're an 8 on your anxiety scale. What would happen to have to move you to a 10? What would make it worse? What would have to happen for you to move down a couple notches? And so I like to do that because it sometimes gives them a very concrete thing to focus on. Focus on the present and the future, not the past. Like I said, you only go into the past when it's in terms of when has this not been a problem for you, or what would it, that type of thing. That's the only time you focus on the past. And of course, you help the client identify their current supports and resources. And so specific facets doesn't dig into the past and does not dig into emotions. For those 2 reasons, I really like using solution-focused brief therapy with adolescents and with men, because both of those populations may not like going into the emotions. I know a lot of men that I work with, they don't want to pick it all apart. They don't want to look at all the emotional dynamics. They don't want to do that. And sometimes that may not be something that they can do. Sometimes men grow up learning that men aren't in touch with their emotions. So I don't really want to dig into all that. I just want them to identify what's going to help them feel better. Also for adolescents, they don't always want to talk about their feelings, and they may not have a really good idea of what their feelings are. They may not developmentally be mature enough to really identify emotions and connect them to events. And so when you could focus on just a specific problem and help them work forward, that makes you get traction. So I might say to one of my adolescent kiddos, okay, so the problem is your probation officer wants to send you to, Pine Hills. Okay, so tell me why that's the problem. Tell me how you want to solve the problem. And I don't get in the emotional part. So they start saying, well, but my probation officer is a jerk and blah, blah. I'm like, okay, I don't care. Let's focus on the problem. The problem is, this is what your probation officer wants to do. What can you do about that? What can you do to make it change? So you're very on task. Specific towards creating change, the counsel helps the client see their internal and external strengths and also provides compliments. I had one patient where we were talking about, what was good in terms of when was your life better? When were you not having all these legal and other charges and issues? And she said, well, actually, when I was dealing drugs, I had my life together. I paid my bills. I took my kids to school. My house was clean, but I was a drug dealer. And I said, okay, well, that's not maybe something to be super proud of, but what do you have to do to be a good drug dealer? Well, you got to be a good business person, right? You got to know your market. You got to know what the cost of your product is. You have to be able to budget. You have to be able to keep a balance. You have to be able to do all those things. So even though it wasn't like, woohoo, you're a drug dealer, we were able to find strengths in that and say, okay, so you actually, have good business skills. How do we use that to create some change? How do we use that to move you forward? Another thing to do is ask what is true today, particularly for those patients who get stuck in the past, who get stuck with resentments, who get stuck with, well, I've always been a screw up. So, okay, well, what was true today? You showed up today. You came here today. You're sober right now. So that is true. So I like sometimes to, once again, just refocuses them on where they're at right now. So one of the things is, like I said, ask the problem what it would be like without the problem, and you ask the miracle question. So the miracle question is frequently used, and it's essentially if you ever take a solution-focused class, they make it really elaborate, asking the miracle question. I'm pretty simple because I don't like to waste my time. And so I will say, okay, so if you woke up tomorrow morning and this wasn't a problem, how would you know? And I think my favorite one, I had a woman that I was doing that with. And I said, well, how would you know that this wasn't a problem? And she said, my bedroom walls would be green. I'm like, oh, okay, what does that mean? She was in a very abusive relationship, and she had always wanted to have the inside of her house painted green. And her husband wouldn't let her do that. He was very controlling, very abusive. And so she said, if I woke up in the morning and saw that the walls of my house were green, I would know that I was not with him anymore. Oh, okay, so we started talking. Okay, so what steps would you have to take to break out of this relationship? What would that look like? What would be some steps to take? And really empowering her to see what could she do for herself to get out of that situation. Scaling and questions and compliments. So finding their strengths and pointing those out to them. Most of you have probably realized a lot of our patients are pretty freaking resilient. So when we can point that out to them, that, hey, you have a lot of good things going for you, let's capitalize on those. And then exception seeking. And that's where, if a person says, well, this has always been a problem. Really? Always? Let's see if we can find some exception to that, because rarely is something always or never. And so you try to seek those exceptions to what they're saying. Drawbacks, some things that make solution focus not the modality to use, it doesn't address their core beliefs. So if they have core beliefs of being a really crappy person, solution focused brief therapy does not address that. It's not going to dig into some of those core beliefs. It's a very short-term modality. It doesn't address past traumas. So if a person has trauma, it's not really something that you're going to be addressing with solution-focused brief therapy. Now, working through the trauma, you might use some solution-focused skills, like, okay, you're feeling overwhelmed and very triggered right now. What are some things that you can do? You can, call your sponsor. You can do some deep breathing. You can do, so it helps with things like that, but it's not really something you're really going to use as your primary modality for working with trauma. It's not effective for mental health. Okay, so a person has schizophrenia. Tell me about a time in your life when that wasn't a problem. They can't go back to that. So the whole point of trying to find out what was it like before is that you can kind of recreate that. well, you can't necessarily undo, so to speak, some mental illnesses. So it's not necessarily an effective thing for that. It's not exploratory, so I'm not going to dig into all those little layers that a lot of us like to poke into. So I'm not going to be doing that. It doesn't work very well if individual, group, or couple is not motivated. That is one thing about solution-focused brief therapy, is you can use it with individuals, groups, or a couple. A lot of, if you look at workforce improvement plans or groups or trainers, organizations, they tend to be on a solution-focused modality. Those are some of the skills they use. It doesn't address subconscious thoughts, and it doesn't work if they are not honest. So if the person isn't honest with you, you're not going to be able to make much progress using solution-focused therapy. And it's really good for, though, folks that don't want to talk about their emotions. It's excellent in couples and family counseling. When there's fighting or dysfunction, you can really just identify a couple goals for them to work for. It's effective in organizations, like I just mentioned. It's action-oriented, so those patients who don't do well with just processing their thoughts or their feelings or whatever, it's really good for them. Okay, you're going to go to a meeting. You are going to sign up for whatever, giving them some specific task. And men tend to like that. They like to have something to do. A lot of the men that I work with, they're like, I don't want to just sit and talk about my crap. I'm like, okay, that's cool. Let's make some action steps. It's good for stabilizing and then referring. So I actually did solution-focused stuff yesterday. We had a woman walk into Rimrock who was not feeling safe. And so I just sat with her. We identified what was going on for her at that moment, what her feelings were. I asked her to scale it. I said, well, let's sit and talk for a little while. I gave her some funny things to read, and she started laughing. Then I said, okay, so what's your number now? And it was much less. And she ended up really within 30 minutes feeling much safer, feeling like she could go back to what she was doing. So it's really good for stabilizing someone. Again, I don't really care about, like the woman yesterday, based on some of the things she said, she had significant mental health history. I don't care. I really don't care. I mean, I do, but I don't. I want to find out what in this moment do we need to do. And it's concise and focused, so I like that as well. All righty, so there you go. There's a quick down and dirty on solution-focused brief therapy. If you want to see how to not do solution-focused brief therapy, go to Google and type in Bob Newhart, Just Stop It. If you haven't seen that clip, you need to. It's hilarious. It's about 6 minutes long, and it is how to not do solution